Hi, Judy here, and I'm with Robert Cervantez at Alpine Physical Therapy. Robert has a master's in physical therapy from the Western University of Health Sciences. Robert, how long have you been a physical therapist?
I've been a physical therapist 20 to 21 years. It's been a great career, and I've had an opportunity to meet a lot of really nice people and have a good time with my job.
Nice. Has your entire career been here in Utah?
My whole career has been here in Utah. I spent my first approximately 12 years in Park City, and then I spent the last 6 to 8 down here in Salt Lake.
Nice. And over your 20-year career, have you seen a lot of changes in the practice of physical therapy?
There's been several changes in the practice. We've kind of moved a little away from more of the modalities, the heat and the stim and the ice, and moved more to joint mobilization and other modalities like dry needling, which is very good though, and exercise to promote health and fitness and to rehab people back a little quicker.
Nice. And their rehab tends to go faster with the new method?
With the new method a little bit.
Oh,
yep.
That's good.
But I still like to throw in a few of the modalities just because they're nice and they calm things down.
I liked the heat and the massage when I had, yeah. So, do you have any specialties that you work on?
I'm very fortunate. I see a lot of shoulders and I treat them. You've probably heard of rotator cuff before. I've treated, I don't know, over my time now, I've probably treated thousands of those, it seems like, whether torn or partially torn or just irritated, and slap lesions and so forth, total shoulders. So I've treated a lot of shoulders in the years, right and left.
Bilateral.
Mm-hmm.
And then what about, do you have advanced certifications?
I do. I'm certified as a certified strength and conditioning coach in addition to my master's in physical therapy. I have some education in exercise physiology, which I did prior to getting my master's in physical therapy. And I'm also certified in dry needling, which is similar to acupuncture.
What does the dry needling do for healing?
We are allowed to cause a trigger point release and get the muscle to release, and that needle that goes in causes an irritation, but in the process of doing so, it releases the chemicals in our body that will promote healing.
Oh, nice.
Yeah.
And then what is the types of injuries that you treat for people that when they come in here, what types of injuries do you treat?
I see a lot of orthopedic based injuries coming from people exercising or live in an active state. So getting hurt on the ski slopes, getting hurt on their mountain biking, out running on trails. So I see ankles, knees, hips, low back, cervical, definitely shoulders and elbow type of patients.
Okay. And what would you recommend for people to do at home so they can maintain their mobility?
Mobility is a very important factor for us as we get older. Being able to keep your flexibility in your lower extremity and in your low back will promote your ability to get around better, and so you don't get so stiff. And so you can do on YouTube, you can find somebody who has yoga and do 5 minutes or 10 minutes, but it's better to do something once or twice a day if you can, and it'll allow you to be more productive. It'll allow you to reach up in the cabinet and get something down so that your shoulders aren't stiff and you're kind of shortening yourself and not able to get there.
And if someone say that they have never practiced yoga or anything like that and they feel like they already don't have mobility, is it too late for them to start?
It's not too late for them to start. It's a good time for them to start, and you just start slowly and you just slowly progress. Maybe you won't be able to hold the yoga stretch for the whole 20 seconds or a minute or whatever the duration is, but you may be able to hold it 5 or 10 and you just work to a longer duration over time.
So start now.
Start now.
Okay. And I know that Alpine Physical Therapy and the University of Utah Health System have a working relationship. Can you tell me about that?
Yes, in December of 2017, we were in a situation where the University of Utah was looking to expand to Park City, and in doing so, they chose to buy our Park City office, and we had this Salt Lake satellite office. So when they purchased the business, they got both facilities, And so that's how I became part of the University of Utah as an employee instead of a business owner. But it was a good thing to do for us and for our employees, because we were able to give them a better benefit package and health package and so forth.
Nice. And it's been a really great
It's
thing
been a good
for
relationship
everybody.
for all of us, and it's been very good, and it's going very well.
Nice. So if people want to book an appointment with you, can they do it directly through your office?
They can contact us directly through our 801 number, or they can call our Park City number, 435 number, and just let them know that you want to schedule if you call Park City for Salt Lake.
Okay, great. Good to know. And I do have a question for you, Robert. When you're not here helping people feel better from their injuries and helping them recover from their injuries, what is it that you like to do?
I'm active right now. I'm 8 weeks away from completing my first, hopefully, Ironman triathlon that I'll be completing in St. George. So it's a distance of 2.4 miles swim, 112 mile bike, and 26.2 mile run.
I wish you the best luck. What does it take to get ready to do all of that physical work?
Takes a lot of time, energy, and a patient wife who has allowed me to have the free time to do this. I started my training roughly back in late September, October, building a base phase and slowly making my way to where I am now, which is 8 weeks away.
Okay, and so how many hours a day do you think you dedicate to your training right now?
I dedicate, on an average, probably 2 to 3 hours a day. And then on the weekends, as it's gotten deeper into the program, the bike rides have gotten longer, so I've actually had to do some 5-hour bike rides. So that's the longest day I've had to do. But most of the time, it's pretty consistent at 2 to 3.
Mm-hmm. And how long do you think that it takes from start to finish for the triathlon?
For me, I'm hoping to be completely done in 12 and a half hours to 13 hours. That's my projected goal.
That's a good day.
So it is a long day.
Yeah. Wow. Well, I wish you best of luck at that.
Thank you.
You're welcome. Well, thank you for taking the
Thank
time
you.
to interview with me. It was a pleasure. And if you have need for physical therapy and you live in the Sugar House area, you can come in and visit Robert at Alpine Physical Therapy. You can get a hold of them at 801-419-0656, or you could call the Park City number at 435-645-9095. Sorry about that. And Alpine Physical Therapy is on 2645 Parleys Way. Thank you.